Hello, I'm Jawad, Executive Medical Director at East Lancs NHS Hospital Trust. This is my update on the 18th of May 2021. I'll start with the numbers of COVID positive patients tested in the community and just run through these to you. In Blackburn with Darwin, we have got 139 people who tested positive per 100,000, Burnley 64, Hyndburn 45, Pendle 39, Ribble Valley 16 and Rossendale 25. That takes to a total of 66 per 100,000 in our conurbation. Now, this is slightly disappointing because if you remember the numbers which I ran through a few weeks ago, we were in low 30s. So there is a spike in the number of people who are testing positive. And that is to do with what you have been hearing on the national news. It's the Indian variant of COVID-19, which has resulted in increase in the number. And although we recognize that significant number of restrictions have been lifted by the government as of yesterday, which was the 17th of May, the increase in the number does cause concern for us. And it does emphasize the fact that we still have to follow what we have been saying previously about the hand, face and space. So please adhere to the social distancing, hand hygiene and facial masks. These are very, very important. We have seen an increase in the number of people attending A&E with COVID symptoms. Not all of them have required admission. Quite a few have been sent home to be managed either in the virtual COVID ward or at home with appropriate treatment. But it does cause concern to us because as of today, we have 4 patients in intensive care. If you remember, about 4 weeks ago, there were none. There are also 4 patients on the general ward. So we are seeing an increase. And one thing which we have seen in the past, that when the number in the community goes up, it is a lag time of 2 weeks before hospital admissions increase. So we have to watch with some concern of what happens in the next 2 weeks in regarding the hospital admission. Hence, the plea and the request again is to follow the guidelines about hand, face and space. It is also important that people in community take up the option of vaccination as they are offered. Government is constantly providing more vaccination and reducing the age group. At the moment, we are offering vaccines to the age group 36 and 37 years. If you are offered the option of vaccination, please take that on. We are also opening up more centers for vaccination and have extended the working times of the mass vaccination sites. So there is plenty of opportunity to be vaccinated at different sites and much longer hours. We are also seeing an increased number of attendances in A&E, which makes that place very busy. Now, A&E is a place where if you are referred by your GP, then please attend. But there are other options before you think of coming to A&E. I have mentioned in the past that your GP surgeries provide a very open access to anybody who wants to be seen. There is 111 service, local pharmacies also offer advice. So please think carefully before you decide to turn up in A&E. We are also continuing our efforts in restoring the activity towards normality. but still, due to various restrictions, the number of activity to the pre-COVID level has not been achieved, but the work is ongoing by various teams. Finally, I'd again like to mention that our hospitals are smoke-free site. Please respect that and be safe by not smoking on site. And if one requires help to quit smoking, there are a number of facilities available through primary care and through hospital where people can be supported in giving up smoking. I will update you in a couple of weeks' time as things progress. But again, I would like to emphasize that please look after yourself, follow the government guidelines, and be safe. Bye for now.